Meet Dr. Vonda Wright, a leading expert in anti-aging and mental health care. She's on a mission to help you live stronger, think clearer, and age smarter. With her cutting-edge strategies and practical advice, Dr. Wright is changing the way we approach health and longevity. Ready to unlock the secrets to living your best life? Let's dive in.
Dr. Vonda Wright, you've been treating patients, learning about medicine, taking care of people, and working in the industry you've worked in for almost 35 years now.
Yes.
To do that,
Yes.
you must have a great deal of passion. You must be on a bit of a mission. So my first question to you is, as you sit here today, what is occupying your focus, your mind, your passion? What is that when you wake up in the morning and you think about the work you're doing and why you're doing it? What is the answer to that?
The answer to the question of why I wake up every day and rush into my work, whether it's into the surgery or whether it's into taking care of individuals or writing, is because I have been working under the mantra of I'm going to change the way we age in this country or in this world. Because when I started, there was this steadfast belief. The national zeitgeist has changed now, but when I started, there was this belief that aging was an inevitable decline from the vitality of youth down a slippery slope to frailty where we would spend 20 years of our lives dying, going to the doctor's office every 3 years. And I never, ever believed that. I never believed it. And maybe it was because when I was a child, I lived in the 70s where you could just take your kid with you to a race. And my dad would do that. And he'd take me to a 5K and say, wait here, I'll be back in 20 minutes. And I would see people in their 50s and 60s racing, and they would be celebrated. Or maybe it's because I started as a cancer nurse and I saw people fighting every day for their lives. And I believed that that was not the destiny that we were doomed to. So as I progressed through my career and I started doing the research myself, I realized that this myth we had in our country or all over the world, that aging had to be this inevitable decline, was based on population studies. And what does that mean? Well, population studies just look at a cohort of people and see what happens over time. There's a huge study funded by the NIH in the United States called the Health ABC, for instance, and they looked at a population of 70-year-olds and just followed them over time. Well, what do we know about populations of people? Well, what we know is that up to 70% of them do not do one extra step of mobility a day. So what we know about aging has been what we know about sedentary living. And so I did not believe that we truly understood how the trajectory of our aging could be for people who remained active across the course of their lives. So my team and I did that original research, and we proved that you can be healthy, vital, active, joyful long into the foreseeable future, much more than we gave ourselves credit for. And it drives me because even over all these years, 35 years, 20 years of it as an orthopedic surgeon, it is only now that people are beginning to pick up the mantle of prevention and not only disease care. And so sometimes I sit back and I think, oh my God, I've been preparing for this time in the history of people my whole career. So I am made for such a time as now.
So interesting, because it's only in recent times, I think from doing this podcast, that I've started to question the idea, the sort of mind virus that even I had, that once I get to a certain age, I just have to kind of concede to the inevitable decline.
Yeah.
And it's only recently that I thought, actually, there's been a couple of people that have came here and told me about how that's not the case. And that actually it is a bit of a mind virus.
Mm-hmm.
Like the virus of that belief, the impact of that belief is what causes you to give up.
Yes.
And just to become frail and to stop moving and those kinds of things.
Well, because our brain tells us, we know this. You've had many discussions about the connection between our brain and our body. Our brain will believe whatever we tell it. And if our brain thinks that, sometime 63, a light bulb goes off and we go from youthful vigor to aging and decline, well, then we start believing that about ourselves. And there's a concept now that I work with all the time that really examines the difference between life expectancy. In the UK, life expectancy right now is 81. Unfortunately, in the United States, it's 77.6. From birth, babies born now have a life expectancy of that much. Our health expectancy, our health span, the amount of healthiness we have is only about 63. So that gives us a huge runway to change the trajectory. And it also tells us that we're not dying at 63. We're dying on average at 81. So we can do everything we possibly can in those 20 years. And we also know that 70 to 80 to 90%, depending on who you believe, of our health and aging is predetermined by our lifestyle choices, not the genes we inherit. So my mother is very thankful that I stopped blaming her for all the health things that go on. But each and every person has the ability to live outside of their genetic predisposition. And that is a very hopeful message that can pivot your mindset virus.
I took the top sort of illnesses and diseases, things like heart disease, lung cancer, I can't even pronounce this one, chronic obstructive pulmonary disease.
Yeah, COPD.
Strokes, lower respiratory infections, Alzheimer's disease, type 2 diabetes. I can't pronounce this one either. Colorectal cancers?
Colorectal cancers.
I nailed that. Breast cancer and prostate cancer. And I got the average ages that people typically get them. Then I weighted it by the amount of people that die from each of those diseases, with heart disease being the most popular. And it did actually come up, I used ChatGPT, I'm pretending I did this math myself. It came up that 62.94 years old is the exact age where, on average, I'm going to get one of these and I'm going to potentially die from one of these.
Those are when they manifest. You may have them before them.
So they're not going to...
Maybe you never knew it, because I have people who say to me when I ask them their health history, what medical problems do you have? And they're like, I don't have any, only because they've never been to a doctor. Or maybe they've been diagnosed, but they haven't gotten so bad that they're not spending 3 days a week in the doctor's office. Or maybe they are sick, those three categories, right? But your ChatGPT data is correct that is when it shows up. And what does that correspond to? That corresponds to when the average person retires. So just when you start thinking you have time to live the life that you envision, you're saddled with health problems that you have not taken care of. But think about it this way, talking about this mind virus and how we need to change it. We can talk about this, but I think that 40 is the most remarkable decade of a person's life. And it's also the time to adult, or get your proverbial expletive together. It's time to get it together from a health perspective. Well, between 40, if you're just noticing your health at that time, because maybe you've been working so hard and you never noticed it before, or you're raising other people, or whatever the circumstances are, between 40 and 63, you have time to course correct. But if you decide at 63 to pay attention, it is much, much, much harder. And so, part of my mission, you asked me why I wake up every morning to change the way we age in this country, is to not only take care of people in my demographic, my middle-aged demographic, but to really get to my millennial children and my millennial nieces and nephews to say, you have such control of your health if you just look up and pay attention.
What's your academic education? Can you run me through your sort of qualifications and how that pivoted and turned throughout your career?
Sure. I have a degree in biology from Wheaton College. And then immediately after that, there was such a shortage of nurses that Rush University said, if you have a good bachelor's degree, come. We'll train you in another bachelor's degree in nursing and a master's degree in 3 years. So I did. And with that, I went and took care of people with cancer and ran the Rush Cancer Institute with the physician that was there at the time. And then at 28, I decided that through a series of decisions we can talk about, that I wanted to do great research, but I still needed to take care of people because it is in my heart and soul to do that. And so I went back to medical school at the University of Chicago at 28, only to choose the longest possible road, which is orthopedic surgery, which is an additional 11 years, because it's 4 years of medical school, 6 years of residency, a year of fellowship, and then I finally emerged.
What is orthopedic surgery?
Oh,
Explain it
how
like a
long do we
10-year-old.
have? Yeah, so orthopedic surgery is the lifetime care of the musculoskeletal system. So what that includes is bones, tendons, ligaments, muscle, adipose tissue. It's the joints, from the spine to the shoulders, hips, the knees. It's everything from cancer care of those organs through each one of those has a subspecialty: hand, foot, sports. I'm a sports surgeon, so I'm trained in shoulder, hip, and knee arthroscopy, meaning I do very big surgery through very small apertures for athletes and active people. But this fun orthopedic sports career I've had of taking care of active people and athletes of all ages and skill levels extends outside of the operating suite, right? I take care of the whole person, which is unusual for an orthopedic surgeon. Usually orthopedic surgeons are very procedurally driven, but I am whole person driven. And I think that stems from, at 23 years old, taking care of people in the fight of their lives, knowing that their whole lives are worth taking care of, not just pushing chemo in the middle of the night.
When you say you focus on the whole person, can you help me understand that? Because I think on one end of that spectrum is doing the surgery,
Yes.
which you do.
Mm-hmm.
And then is the other end of that spectrum thinking about their psychology, their emotions, how they're feeling?
I'll give you a few examples. So if you're you think of a sports surgeon taking care of young athletes. So if I have a young athlete come in I'll give you an example of a real person. He's 19. He has been an athlete his entire life and been great at it, right? But never been hurt, had the great fortune of never being hurt until he stepped wrong. He got slide tackled on the football field and he blew out his knee. And his family was moving, so he didn't get immediate care like he could have had he been in his own town. So weeks later, he shows up to me with a knee that's completely non-functioning. This child, who's a 19-year-old man, is panicking in his brain. He doesn't know why he's in so much pain, why his knee won't work. Psychosocially, his family is in transition. They don't have any of the support system, and he no longer has his own team. So that young man is dealing not only with the physical pain of injury, he's dealing with the psychological anxiety of, oh my God, oh my God, oh my God, what just happened to my knee? Will I ever play again? And they're dealing with the social aspects of, here's a family without social support. So as a whole person doctor, viewing this family not only as their sports surgeon, you have an ACL tear, your meniscus teared. Here's how I'm going to fix it. Here's what we need to do before then. Here's the technical aspects of the surgery, but how much protein are you eating? Because I need your body in tip-top shape to heal. So I talk to my patients about their nutrition as well as their surgical. But then from the perspective of, I too am a mother with a lot of children, and thinking of myself, how am I going to meet the needs of my child? Thinking of the mother, she has no resources in this town. She just moved here, right? Trying to set them up with the other people they will need to be surrounded with care. And that approach to this individual family is exactly the surrounding them with care approach we take with professional athletes. There is not one thing that is left unturned for a professional athlete. We take care of them from the minute they wake up to the minute they go to bed and their family needs. So this whole person care extends all the way across all types of people. For a woman, for instance, who comes with it's so typical for midlife women to come in with an inflamed shoulder, a frozen shoulder, she'll come in because her shoulder no longer moves. But knowing what I know about the life cycle of a woman and what happens in midlife, before I even address the shoulder, because sometimes they come in saying to me without any prompting, I think I'm falling apart. And sometimes I think I'm going crazy because I didn't do anything to my shoulder, right? When they say that to me, we immediately start talking about, well, how are you sleeping? Are you having any hot flashes, night sweats? So that I address them as a midlife woman who's lost their estrogen, not just as a shoulder that doesn't work, because for me, that's pretty cut and dry. It's the rest of it that truly is taking care of the whole person. So that's what it means to me.
Mm. It's personal to you, isn't it? I feel like you have a great deal of empathy. I can feel it on on the surface of you. I can see it in your face.
Yeah.
Where does that come from?
You know, I think that I'm a much better, listen, you make people cry on this podcast, and I think you're going to make me cry, and I don't mean to, but that kind of question, I think that this unrelenting need to take care of the whole person has to have come from my time as a cancer nurse, because I was only 22 to 28. I was a cancer nurse. And imagine what it's like to be so impressionable, right? I got all this education, but in the middle, so my job was giving chemotherapy to people who were in the struggle of their life. And I'm 23 years old. And chemo is pushed in the middle of the night. And at the time in the 90s, we did something called primary nursing, which means every time that person came in, if you would have come in, I would have been your nurse every time you're in the hospital, every month for 6 months. So the kind of therapeutic relationship you develop is meaningful. And so I was 23 years old, 23 to 28, the formative times of how I built my perspective on the world. And I'll never forget, this is the one story. There's so many stories like this, but this is the one story that answers that question, I think, why this is personal to me. So I'm taking care of this woman. And, you know, many of the people I took care of won their battles. You know, I was with them for 6 months every night. Some nights, because people just want to feel normal, I'm giving them their chemo, they're watching TV and buying stuff online on the TV. And I'm like, why are you buying all this? Because they just want to feel like themselves, right? And many people successfully walked out and forgot our names, right? But not everybody did. And so this one family, she had been with us for 6 months. And I don't know if you've ever been around people who are losing their battle with an illness or are living the last days of their lives, but you can tell it's coming just by the way they breathe. It is true. People rally right before they die. And so I knew this woman's time was coming, but she had the most faithful family, Stephen. Her family came every single day, and she had a big family, and we knew they were coming. They were kind of loud, and we loved having them here. But the night that answers this question, I knew it was going to be her last night. You can always tell, and it was just she and I, and the light in a hospital room, there's a light over the bed and then the bed. So there's this light behind her, and she's breathing in an agonal way, but I can tell that she's waiting. She knows her family is going to come the next morning. So we make it through the night. It's just she and I, and in the morning in this hospital in Chicago, there's a window at the end of the hallway that faces Lake Michigan, and the light starts coming in, the floor lights up again. And that's starting to happen. It's about 7:00, and I hear the elevator bing, and it was her family coming. So I step out into the hallway, and this one was different. They always came together every day, but this time her sister was dressed in her wedding gown, and the whole family with it was in their tuxedos because her sister was going to get married that day, and they wanted her to be part of that, even though there was no way she was ever going to be part of that. So I'm 23 years old. I'm standing in the doorway. My patient is over here. Her family is coming towards me. And that indelibly seared in me the balance between life and death, the woman who is not going to continue her journey and her sister who is beginning her journey. And I don't know how at 23 years old for that not to impact what I care about in life. Stephen, if you come to my house, I don't give a rat's ass about my curtains or buying the shoes with the red soles, even though I can. But at 23, that kind of life and death made me decide that people were worth working for and worth saving. And so she had waited for them to come to her that day so she could share in the last family time they were going to have together. And I don't think you come out of a situation like that without your whole life perspective being different. And so even though, you know, I'm a sports doctor now, how is that remotely as hard as being a cancer nurse? I am a much better doctor now than I would have ever been had I gone straight into medicine.
Well, what is that perspective it's given you specifically that then translates to being an even better sports doctor? How does it change
It
how you
just
showed up?
means that I can't view the procedure as just putting screws in the ACL or what. I tried out a new ACL procedure last week. It was fascinating, but sometimes that is the beginning and the end. That's not the beginning and the end for me. How this kid, it was this 19-year-old kid, how this kid is going to recover in 6 to 9 months and go back to living the life he envisions, how he's not going to feel abandoned by the sport that he loved, or how am I going to help him find a new team? Because sport is not only an individual thing, it's an entire environment. It's the society the kid lives in. So for me, it's not just the cool new technique I did on Wednesday in the OR. It's taking care of that whole person through the whole journey for the next 9 months.
The lady that you were taking care of when you were 23 years old, has that impacted how you view death?
It has. I view death. We're all going to die, Stephen. How rapidly we get there can change. How we arrive there can change. How we feel about our life can change. But we're all going to get there. So I don't view it as something to run away from at all. In fact, in some circumstances, in some of my patients' circumstances, or even as an orthopedic surgeon in some of the traumas I've been involved in, I think death can be kindness, and death can be done with extreme dignity. I don't think it's always the enemy.
Mm-hmm. One of the things that I think is also really sort of front of mind in that image of the lady in the bed when her sister arrives in the wedding dress is that she had friends and family there.
Oh my goodness.
And a lot of people,
right.
There's so much beauty in that moment, regardless of the reality of what's going on there, that she's losing her life, but she's losing it surrounded by a group of people that love her. And I think for many of us, I actually had a conversation with a good friend the other day, and their biggest fear in life is that they'll actually end up aging and dying alone because they don't have children yet, and they don't have children at all. They made the decision not to have children. Mm-hmm. They don't have siblings. So, if I'm not scared of death, I'd like to extend my health span. But when I do die, I would like to have people around me that love me. And that's one of the things that I think she clearly had.
Yeah, she did. It's funny you mentioned that. I think about that. What happens if we live so long in our quest for longevity that everybody we love or raised has already gone before us? And I don't know, what do? Would I hire the girl next door to sit with me, take me to my doctor's appointments? Yeah, I don't know what to do.
I could probably pay a few people.
It takes a little bit of planning.
So if we talk then about this health span issue and your central mission, which you described at the start, usually when I have these conversations, I try and hazard a guess where I should begin. But actually I want you to tell me where we should be beginning. If we're talking about extending our health span, where does that begin? Where do we need to start this conversation?
That begins when your parents are raising you and they have the choice of teaching you how to eat, teaching you. I'm old enough that literally I got a cell phone at 38. So this is not a problem with me growing up, but there's a problem now where we don't send kids out due to safety and digital to just go play and don't come in until dinner. That was a real thing when I was growing up. And so what we know is children's mitochondrial load, meaning how many of our powerhouse mitochondria metabolic kingpins are really predetermined by how active we are as a child. So it's really a concern for those of us interested in metabolic health is, what are we doing when we raise our children to sit around for the first 10 years of their lives when they're really made to run around, right? So it begins with what we teach our children. And I hear parents a lot of times saying, oh, my kid won't eat this or that, or I can't get them to do anything. And I'm not scolding them when I respond in the way I'm about to respond to you. I get it. I'm the mother of a blended family of 6 children, and you can't always make your children do things. But here's what I know. Children learn from what they see. My children were foam rolling with us. They learned to eat vegetables, or they didn't get up from the table, or they learn what we teach them. So the time to begin is when our children are little. Some would say the time to begin is in utero, which is frightening because I might have done things differently during my pregnancy, but when they're little. But as they're being raised, I certainly think the time to really begin is no later than your mid-30s. I call between mid-30s to mid-40s, with 40 being the center of that, the critical decade. Literally, we're not children anymore. At 30, the literature says we've probably maxed our bone out. We've probably maxed our muscle out.
Wait, what do you mean? I'm 30.
I know.
What
I'm
do you mean I've
thinking about
maxed my
you
what?
right now.
What do you think I've maxed my muscle out and my
It
bone out?
means that some scientists, muscle scientists, believe that at 30, we've got our peak muscle mass. And unless we really invest in growing more muscle the rest of our lives, like if you choose to be sedentary the rest of your lives, you peaked at 30 and you're using it the rest of your life, right? And so same with bone. Bone maxes out at about 30 unless we continue to invest in it. Well, what do we know? 70% of our population is sedentary and don't reinvest. So between 35 and 45, I call it the critical decade. If you've never thought about your health before, now's the time to hone in. We need baseline labs. We need your first physical. We need some of your first screening exams. I think men, this is not policy anywhere, but I think as I'm trying to replace testosterone in men in the future, I don't know what I'm raising them up to. I know I'm putting them within a healthy range, but I would want to return you to what your testosterone was when you were a young man like you are now, and not just guess. I think we need first labs, first physicals, to be more of a quantified self, just like we were talking earlier, you saw a human brain for the first time, to notice our bodies so that we can take better care of them early, so that we can then do the exercise prescription that I'm sure we'll talk about going forward, because it becomes very, very hard with every decade. But I think for men, 40 to 50 is an amazing decade for you for a lot of reasons. For women, I think between 35 and 45 is critically the time to get our stuff together before our hormones start walking out the door. So it's much earlier than you would suspect. If you suspected maybe 50 is the age, maybe 60, no, too late, not too late, much harder, right?
Mm-hmm.
Yeah.